Hello! I am going to do a quick recap on anaphylaxis. Anaphylaxis is an extremely dangerous allergic reaction, usually caused by an overreaction of the body's immune system, most commonly caused by insect stings, bites, jellyfish for example, or food, nuts, seafood allergies, anything like that, or even drugs or medications depending on who you're dealing with. In an anaphylactic reaction, the immune cells release massive quantities of histamine. This can cause the rash, the itching, and in big quantities also life-threatening issues with airway, breathing or circulation. So during an allergic reaction, the airway issues can be caused by blood capillaries leaking, and that can cause swelling which could block the airway. The breathing can be constricted in the windpipes, in the lungs, a bit like an asthma attack. So if the pipes become smaller, it becomes a bit more laboured breathing, a bit harder to actually get enough breath in. And for the circulation, the allergic reaction can make the blood vessels dilate to 3 times their usual size, which can result in life-threatening fall in blood pressure. The fluid loss from the leaking capillaries will make this even worse. If this is happening, it's really, really important that you get your casualty to lie down. If they stay standing or sitting, this could result in a lack of blood to the heart, and the heart can stop instantly. So lying down, really important to remember that if it's a really severe anaphylactic reaction. In terms of recognising anaphylaxis, there's 3 main characteristics. Rapid onset. The casualty usually becomes very ill very quickly once exposed to whatever they're allergic to. They could have 1 or all 3 of the airway, breathing or circulation problems, or a combination of any. Often there's a skin rash, flushing and or swelling of the face, eyes, lips, etc. But again, not all casualties will have the same things going on, so you need to be looking for what is going on with each individual. In terms of what you're looking for with the airway, swelling of the tongue or the lips or the throat. They might have a feeling that their throat is closing up, which could affect their voice, might sound hoarse or loud-pitched. Their breathing might become noisy or wheezy. They might feel they've got a tight chest, a bit again like the asthma attack. In terms of circulation, again looking for dizziness or feeling faint, making sure they're lying down. If they are sitting up and they're feeling faint, then obviously making them comfortable lying down somewhere that's suitable. Their skin would be pale, cold, clammy. Their pulse is likely to be fast. The rash, if there, may well disappear, or they may not have a rash, but there's all these other recognition signs to look for. There could also be issues with how they're feeling in terms of wellness, so nausea, vomiting, stomach cramps, even diarrhea, which is caused by the capillaries leaking into the gut. So looking for any or all of these signs when assessing a casualty for anaphylaxis. They may also have a sense of impending doom or anxiety linked into that struggle to breathe. And our treatment for anaphylaxis, so initially calling 999 for emergency help, getting the casualty to lie down, as we've said before, to make sure they don't feel faint or pass out due to lack of blood flow. If they have an EpiPen or an auto-injector of adrenaline, then encourage them to do this themselves. If they need assistance, be ready to assist if necessary. If they do become unconscious, going into your ABCs, checking the airway and breathing. Have the AED on hand if there's one close by, just in case their breathing does stop, if their airways are constricted enough for the breathing to stop. And the adrenaline can be repeated at 5 to 15 minute intervals if there's no improvement or if symptoms return.